cardiac arrest, sudden stoppage of heartbeat is called cardiac arrest. The etiology of cardiac arrest is plenty. The main and very important etiology is massive heart attack. If there is sudden occlusion of the left coronary artery, the heart stops immediately. Apart from heart attack, there are a lot of causes which create problem and produce cardiac arrest. The systemic disease, mainly the disease of the kidney. If there is chronic renal failure and there is hyperkalemia, if potassium level is very high, then there is sudden cardiac arrest. In cardiology, there are two groups of disease. One is congenital heart disease, another is acquired heart disease. The congenital heart disease, there are certain heart disease, particularly those who are born with heart disease. Say for instance, cardiomyopathy or cyanotic heart disease or intractable arrhythmia due to carditis, producing ventricular tachycardia. If it is not controlled, it went to ventricular fibrillation and followed by cardiac arrest. Acquired heart disease, the rheumatic heart disease, the aortic stenosis is a very common cause. Patient was all right, sitting on the bed. Suddenly he fall down from the bed and heart stops. And we cannot revive that patient. That is locking of the aortic valve in aortic stenosis. There is rhythmic disturbance in the heart beating that produce cardiac arrest. Mainly intractable ventricular tachycardia, which occurs mainly in cardiomyopathy. Resuscitate the tachycardia once, twice, thrice, and suddenly we cannot revive the patient. There is another cause which creates sudden cardiac arrest, is the disease of the conductive system, electrical conductive system, the electrical path. If there is heart block, the heart block, sometimes it may be complete heart block, sometimes it is bifascicular heart block or trifascicular heart block, went to complete heart block, and at a time there is sudden cardiac arrest, patient goes into strokes, but that patient can be revived. If immediately somebody gets thrust on the chest, heart comes back and patient survives. But this arrest is so certain and so sudden that there is very difficult chance to survive the patient. Our great politician, he had cardiac arrest in Delhi. He was minister, the then minister at that time, Priyaranjan Das Munshi. His cardiac arrest has been resuscitated after a long time, resulting there is brain death. He survived with brain death for a quite long period. Problem is this: brain can survive only for 3 minutes, 3 to 4 minutes maximum. And if we cannot revive the patient or resuscitate the patient adequately within that period, so there is chance of brain death. Heart may be survived, but brain death cannot be avoided. So it's a very dangerous disease, and there are lot of procedures we follow after the cardiac arrest, especially pacemaker if necessary, or we go directly to implant permanent pacemaker. So that is known and that can be done. There are other instances too where the cardiac arrest took place in systemic disease. So if systemic disease is adequately tackled, then cardiac arrest can be prevented. But it is really very difficult to predict who will go into cardiac arrest and what precaution we have to take before that, because it is impossible to predict that this patient will have cardiac arrest and so do this and do that. It occurs suddenly and kills the patient. So that's all.